There is a great difference between premature ejaculation and erectile dysfunction. And what I've realized over the years is that most men don't understand or know the difference between the two. So what I seek to do in today's video is that I am going to carefully explain to you the difference between these two conditions, so that men from now on will know exactly what we are talking about, because you need to know the difference. Otherwise you may end up taking medication for this one instead of this one. I hope you understand. So what I want you to do is to just watch this video all the way to the end. Now let's begin with the premature ejaculation. When we talk of premature ejaculation, we are talking of a situation whereby a man cannot last in the other room for even 1 minute. Yes, anytime a man cannot last, anytime a man enters the field, a man enters the other room, and within 1 minute the man is done. Within 1 minute he is down. That man can be termed as someone who is suffering from premature ejaculation. Meaning premature, it is something which is premature. You are not supposed to get there, but you have gotten there early. That is premature ejaculation for you. I hope you understand. Yes, this man who is suffering from premature, he is okay. Everything is, erasing. The bulla, the manhood, everything is erected fully. But at the end of the day, when he enters the other room, things will just drop within 1 minute. So such a man is suffering from premature ejaculation. On the other hand, erectile dysfunction. When we talk of erectile dysfunction is a situation whereby the man cannot even raise up. When the man is not able to even raise up, and things will be done to it, yet all the stimulations, everything, you try to spark it and spark it and spark it and spark it, still nothing will happen to it. So such a man or such a person can be called someone who is suffering from erectile dysfunction. So the question is, between the two, which of them is more serious? I'm asking you, between the two, if you are left with no option than to choose one of them, which of them do you think you will choose? I strongly believe that many of you would choose the premature ejaculation instead of the erectile dysfunction. This also goes to tell you that one is more serious than the other. And the more serious one among these two conditions is erectile dysfunction. Because erectile dysfunction can be caused by so many factors. So many factors, such as improper blood flow into the bulla. When blood is not flowing straight into the bulla, automatically there is no way the man can raise up. There is no way the bulla can stand up. You understand? And what normally will cause blood not to flow in there may be as a result of either arteriosclerosis. Arteriosclerosis is the hardening of the arteries. Anytime the arteries which leads to the bulla is hardened, meaning it normally will become narrowed. It can be narrowed or hardened as a result of buildup of plaque. So when plaque builds up inside, in and around your veins and your arteries, you can be suffering from, or you may be suffering from arteriosclerosis. And arteriosclerosis can prevent blood flow into the bulla. I hope you understand. And that is the only reason, or that is one of the reasons why a man can suffer from erectile dysfunction. And another factor that can cause erectile dysfunction is neuropathy. Yes, neuropathy. Neuropathy is a situation whereby the nerves the cells in and around the bulla, dies off or eroded. Okay, and when the cells around your bulla, your joystick, your manhood, dies off or erodes off, automatically it can cause or it can lead to what? To erectile dysfunction, because at the end of the day, the bulla will no longer function. So basically, these are some of the two reasons why a man, manhood or bulla can go off entirely. You understand? So the reason why I'm shooting this video is that most men are taking medications they are not supposed to take. Okay, they are taking medications they are not supposed to take. There are medications for erectile dysfunction, and there are medications for premature ejaculation. Okay, but in most cases, both conditions or both medications are normally merged together in order to function the same thing. I hope, or to give the same importance or function. That is why most men think that any medicine which is designed for, or any aphrodisiac is capable of making the bulla strong. No, some medications, some aphrodisiacs, they are meant for only premature ejaculation, and there are some too, they are meant for erectile dysfunction. I hope you understand. And then you ask yourself, what also causes premature ejaculation? This time around, the bulla can stand all right, but as soon as the person goes on off, within 1 minute the person off. Sometimes it may be caused by oversensitivity of the what? Of the heart. Every bulla has a heart. Every bulla, every manhood has a heart. That heart contains millions of cells, millions of nerves, and these nerves are responsible for stimulating the feeling, stimulating the arousement. I hope you understand. So when that nerves around that area becomes too sensitive, even by mere touching it with your hand alone can arouse the man, not to even talk of entering the pitch. So most of the men who are suffering from premature ejaculation, within 1 minute, within 1 second they are down, most of them are as a result of what? Of oversensitivity of the heart. I hope you understand. Most of them are oversensitivity of the heart. And another factor is this: maybe the man may be too anxious to do the job. For instance, two couples or two married men, one is staying this, or two married men who are staying apart. Maybe you people have been staying apart for, let's say, 3 months, for, let's say, 4 months, for, let's say, 1 year. You haven't seen each other, you haven't met each other with for the past 3 months, for the past 4 months, for the past 1 year. Always you speak, the two of you will speak on phone, and sometimes when the conversation becomes so naughty and so dirty, you people might end up doing certain things I'm not supposed to even say here. So that anxiousness is there, it's already registered. Okay, that anxiousness is already registered. So in a day, or as and when you people are going to meet for the first time, maybe for the first time in 3 months, for the first time in 2 months, for the first time in 1 year, as you people are going to meet together, that day as a man, if you are not careful, you might not even last for 30 seconds, not even talk of 40 seconds, 1 minute. You might not even last for 30 seconds. Within 30 seconds, you will calm down, simply because you have over prepared your mind that this is what you want, and the mind too will follow your preparedness, and definitely you are going to go down. So some of the premature ejaculation issues mostly are not medical. Okay, they are not medically inclined. Some of them are psychologically inclined. So we need to also check that. Today, as I said, I'm not going to prolong this video, and I'm not going to give out any remedies. In my next video, I'm going to come out with a remedy you can use in the case of premature ejaculation, and then in the case of erectile dysfunction. I'm going to introduce you to some herbs, very, very common herbs, which are also very effective. So I don't think you would want to even miss that video. Once again, let me thank you for watching the video from the beginning all the way to this end, and let me also plead to you to kindly subscribe to this YouTube channel. Don't forget to click onto the notification bell icon, select all, so that anytime we come your way with videos like this, you'll be the very first person to get notified. Let's meet again in the next one.